In this episode of the Nurse Practitioner Podcast, Doctors Denise Rowe, Yeow Chye Ng, and Louise C discuss addressing transgender patients' barriers to access care. Could you please share with the listener some background history, demographics, and common terminology used to describe the transgender population?
The United States Census and other demographic studies currently do not collect data on the gender identity, so the exact number of transgender people in the United States is unknown. However, studies estimate that transgender individuals account for 0.3% of the United States population. In 2011, there were an estimated 9 million transgender people in the United States. Given the most recent federal anti-discrimination measures passed to protect the LGBTQ community, more transgender people may choose to disclose or declare their gender and sexual orientation in the future. Thus, the transgender population is projected to rise to over 10 million people by the year 2020. There are various common terminologies used in discussion of the transgender population. The term gender is defined as the attitudes, feelings, and behaviors a society expects a particular sex to possess. These are the cultural and social expectations or norms, such as how we dress, how we speak, or how we behave. For example, we see these norms attributed to and differentiated between males and females. Gender identity is the gender to which a person identifies. An individual may identify as a male or female. Gender identity is not the same as sexual orientation, which identifies the sexual attraction to another person, such as male, female, or both. Another term is gender expression, which is the outward presentation or display of one's gender. For example, expressing male or female norms. So when gender identity and or gender expression differs from what is associated with the designated gender, that is called gender incongruence. Cisgender defines persons whose gender identity match or is congruent with the sex assigned at birth. By contrast, the term transgender defines persons whose gender identity or expression is different or incongruent with the sex assigned at birth. For example, a trans man is an individual who was assigned female at birth but identifies as male, and a trans woman is an individual who was assigned male at birth but identifies as female. Lastly, the terms gender dysphoria defines the distressing feelings experienced by individuals who do not associate themselves with the gender they appear to be. For example, an individual with a male reproductive system and other physical traits attributable to men may feel that he or she is female, and an individual with a female reproductive system and physical traits may feel that he or she is male. Gender dysphoria is the current diagnosis used in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5.
What are some of the common health disparities facing the transgender population today?
Studies tell us that victimization and stigmatization significantly impacts health in the transgender population, and consequently, that results in many health disparities. Programs like Healthy People 2020 indicate that sexually transmitted infections, mental health problems, and suicide prevalent rates are significantly higher among transgender individuals compared to heterosexuals and other LGBTQ groups. Psychological distress is very common. One study reviewed showed clinical depression rates as high as 44% and anxiety rates as high as 33%. Studies also consistently show that suicide attempt rates are as high as 40%. That is about 9 times the attempted suicide rate in the general population in the United States, which is approximately 4.6%. Sexually transmitted infection rates of HIV among transgender women account for 20% of HIV cases globally. HIV rates have been found to be impacted by socioeconomic factors such as poverty, unemployment, and homelessness. These factors are common within the transgender population. There are also higher rates of illicit drug use and drug abuse in the transgender population as compared to the general population.
Based on current clinical research, would you like our listeners to know about healthcare barriers that exist today for transgender patients?
Despite advances in transgender care, there are still barriers that this community faces when it comes to the healthcare system. A study by the Institute of Medicine found that the major barriers to access to care for this marginalized group include inadequate medical insurance, stigmatization, and a knowledge gap by healthcare providers. Gender reassignment procedures are costly, but lately more insurance companies have expanded coverage for this transgender-related procedure. This was in direct response to the Affordable Care Act regulations that prohibit insurance organizations from discriminating against clients based on sexual orientation and gender identity. Part of the problem is that gender reassignment surgery is considered cosmetic by some. So this creates inequitable distribution of financial resources. As noted in our manuscript, the Human Rights Campaign provides a list of insurance carriers that offer to negotiate transgender-related care. Now, when it comes to stigmatization, despite recent social acceptance, there exists a long history of anti-LGBTQ bias that continues to influence health-seeking behavior even today. Many transgender patients are resistant to disclosing their gender identity to caregivers, especially if there are any issues of trust. About 45% of transgender patients do not inform their healthcare providers of their true gender identity. Virtually all transgender people experience some form of discrimination in public places, such as bathrooms, shopping malls, restaurants, airports, public transportation, and cinemas. 2018 was the most violent year for transgender individuals, with a record 22 deaths. Statistics indicate that hate crimes have resulted in 128 deaths of transgender individuals across 32 states in the U.S., and this was for the period from 2013 to 2018. We also identified a professional knowledge gap. There are documented instances in the literature that show providers relied on patients' opinions on how to meet their treatment needs. So training is needed for healthcare providers to advocate for and deliver culturally congruent care to LGBTQ populations.
What criteria must transgender patients meet before initiating cross-sex hormone therapy, and can you briefly discuss hormone therapies currently in use among transgender patients?
Yes. Before I answer this question, I would like our listener to understand that before initiating any cross-sex hormone therapy, the healthcare providers, like nurse practitioner, we should consult the patient about the risk and benefit of the hormone therapy, including impact on fertility, as well as realistic expectation about the outcome. Inclusion criteria for cross-sex hormone therapy for adults. 1. Fulfillment of the diagnostic criteria for gender dysphoria, and this is based on the 5th edition of the Diagnostic and Statistical Manual of Mental Health Disorder, or DSM-5, and it has to be carried out by a qualified mental health provider or other qualified professional with expertise in the treatment of transgender patients. 2. Assessment and management of the other concurrent psychiatric or medical comorbidities. 3. Affirmation of the desire and readiness to live and be accepted as a member of the opposite sex and wish to make the body as congruent as possible with the self-identified gender. The last one will be the capacity to provide informed consent. So, exclusion criteria for female to male cross-hormone therapy are being pregnant, currently breastfeeding, history of active breast cancer or hormonally sensitive cancer, and unstable or severe cardiovascular disease. Exclusion criteria for male to female cross-sex hormone therapy are history of active venous thrombolytic events, active breast cancer or hormonally sensitivity cancer, significant kidney impairment, and hyperkalemia if the patient is taking some other medication. As for hormone therapy that is currently used among transgender patients, it would divide into two groups. The first group is for transgender women, male to female, anti-androgen therapy, spironolactone or cyclopaterone acetate or gonadotropin-releasing hormone agonist therapy combined with estrogen therapy. Research has strongly suggested against the use of ethyl estradiol because of the increased risk of venous thromboembolism. Transgender women treated with estrogen should follow the same screening guidelines for breast cancer as for non-transgender women. The next group, for transgender men, female to male, testosterone ester, which administered intramuscularly or sub-Q, or testosterone gel, depending upon patient preference. However, higher testosterone levels are more easily achieved with parenteral therapy. Current literature suggests that transgender men receiving testosterone therapy to be monitored for erythrocytosis and dyslipidemia, which two potential consequences of androgen therapy.
What are some suggestions that medical providers can consider to create a welcoming environment when providing care to the transgender patient population?
So some suggestions that medical providers can consider to create a welcome environment for this population is that a practice should revise intake forms to include more sexual orientation and gender identities, include domestic partnerships or partnered in addition to single, married, widowed, or divorced. Institute non-discrimination policies in your practice and make them visible. Provide and display some educational materials that are LGBTQ inclusive and LGBT specific. Make sure all staff, receptionists, clerks, medical assistants, and healthcare providers address patients using their preferred names and pronouns. Ask questions when you are in the exam room like, who lives with you? Are you in a relationship? Rather than asking, are you married? Or do you have a boyfriend? If possible, have patients enter their sexual and gender identity information through a patient portal into the electronic health record. Recognize the need for an interdisciplinary approach for care of transgender individuals and have references available for those providers that have expertise in the care of this population. Locate community resources that are inclusive of LGBTQ individuals. Nurse practitioners and other healthcare providers should be knowledgeable about the treatment options open to transgender individuals, just like we have discussed previously. Have the ability to provide appropriate safe sex advice and immunizations based on a patient's sexual orientation. Understand the LGBTQ cancer risks and other health disparities and provide appropriate screening. Know what screening to provide transgender patients who are transitioning or who have transitioned, and understand family planning options that are available to same-sex couples.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.